Hi, thank you so much for having me today. My name is Christine Panese, and I'm very excited to be able to share the results of a research study that I worked on with Dr. Lossie and Dr. Quint on the vaginal lengthening experiences and pelvic floor symptoms in individuals with MRKH. It is our research team's goal to improve care based on the experiences of individuals with MRKH. So to give you some background on how this study got started, it was individuals at events like this, the annual Michigan Medicine Beautiful You MRKH Day, who had shared with us about their bothersome urinary symptoms and prolapse symptoms. So we decided to design this survey to assess how common urinary prolapse and bowel symptoms are among individuals with MRKH. We also know there are various ways to lengthen the vagina, and so we wanted to understand better the experiences of women in terms of vaginal lengthening, as well as international trends globally. In order to do this, we developed a survey that asked specifically about urinary, prolapse, and bowel symptoms. And we also asked an open-ended question that asked about experiences and challenges with vaginal lengthening. 808 individuals responded to the survey, representing 40 countries. 616 individuals answered at least 75% of the questions and were included in the analyses. As you can see on the right, 81% identified their race as Caucasian, 3% as Black, 9% as Asian, 3% as other, and the remaining 4% as listed. The median age of respondents was 29 years, with a range between 18 and 75 years of age at the time the survey was taken. And the median age at diagnosis of MRKH was 16 years, again with a wide range from it being diagnosed at age 1 all the way until age 46. As you can see here on the right, with regard to diagnosis, 45% of people reported a diagnosis of MRKH type 1, and 22% reported being diagnosed with MRKH type 2, 31% reported other, and 2% were unsure of their diagnosis. With regard to vaginal lengthening history, 54% of respondents reported at least one vaginal lengthening treatment. Of those, 72% reported dilator use, 34% reported coital dilation or sex, and 39% reported undergoing surgery. As you can see on the right-hand side, the majority reported having a Mackendorf, followed by a bowel graft, Vecchietti, or Davidoff procedure. 46% reported never having undergone vaginal lengthening treatments in the past. When we looked at trends internationally, we found that vaginal lengthening was less commonly reported in Africa, Asia, and South America, but most individuals in North America and Europe reported vaginal lengthening treatment. Dilation was the most commonly used vaginal lengthening method throughout the world, but 46% of respondents reported not using any vaginal lengthening treatment, including 43% in North America and 36% in Europe. When asked about urinary symptoms, we found that urinary symptoms were very commonly reported. Only 30% of women reported no symptoms, and the remaining women reported at least one of the symptoms listed here, including leaking, urgency or having to run to the bathroom immediately, frequency or having to go to the bathroom frequently, recurrent urinary tract infections or bladder infections, and pain with urination. Not only were these urinary symptoms common, but almost 80% of people said that they were bothered by the urinary symptoms. Unfortunately, only 31% had ever talked to a doctor or healthcare provider about their urinary leakage. Prolapse symptoms like lower abdominal pressure, pelvic heaviness or dullness, or bulge symptoms were also really common. 40% reported lower abdominal pressure, 30% reported pelvic heaviness or dullness, and 10% reported bulge symptoms. Bowel symptoms were reported by a quarter of individuals, specifically constipation and leaking of gas or stool. Of note, we know leaking of gas and stool are associated with impaired psychosocial function and decreased quality of life. Unfortunately, most individuals in our cohort had never spoken to a healthcare provider about their symptoms, despite nearly half reporting bother, which highlights the importance of the medical providers screening for these symptoms. Not only did our survey identify that urinary, prolapse, and bowel symptoms were common in individuals with MRKH, but the responses to the open-ended question about challenges, complications, or issues experienced during vaginal lengthening were really important. There were some themes identified, and these themes included difficult physical symptoms, which encompassed pain, bladder, and bowel symptoms that were attributed to vaginal lengthening treatment. The second theme was practical and psychosocial challenges. This was the time burden, the psychological distress, anxiety, and concerns regarding privacy issues that affect how often someone lengthens the vagina. The third theme was intimate relationships and sexual satisfaction. This encompassed both the positive experiences and the challenges with regard to sexual relationships when it comes to vaginal lengthening. And the fourth theme was the impact of the experience with healthcare providers, both the ways in which helpful and unhelpful interactions with healthcare providers shaped individuals' experiences with vaginal lengthening. We are so appreciative of all the individuals that took the time to contribute to our study. We found that 54% of individuals with MRKH reported vaginal lengthening treatment, and of those, 40% reported vaginal lengthening surgery. We also found that vaginal lengthening experiences varied by region and between individuals. However, shared themes show both positive and challenging aspects of vaginal lengthening. And finally, urinary and prolapse symptoms were common and bothersome, yet not often discussed with healthcare providers or physicians. We hope that individuals with MRKH are empowered to discuss their urinary, prolapse, and bowel symptoms with their physicians and gynecologists. We aim to encourage medical providers to screen for urinary and prolapse symptoms throughout an individual's care. We have identified aspects of care that can be optimized and emphasized, specifically clear discussions of diagnosis, treatment options, and expectations, ongoing psychosocial support, and care throughout diagnosis and beyond. In the future, we hope to better understand the factors which influence a person's individual decision regarding vaginal lengthening treatment. Again, thank you to all the individuals who have participated in this project, and thank you very much to Dr. Quint and Dr. Lossie for the opportunity to share this information with all of you and for their collaboration and support. I welcome any questions.